An interesting topic, and I got to be honest, this strikes a chord with me, hits home with me. It's Dr. Myers-Hurt. He's a medical specialist with Diamond Physicians, and we're talking about parents giving kids wrong dosage for medicine. Good morning, Doc. How are you?
Morning, sir. Doing well. How are you?
Good. Tell me, how often does this occur where a parent innocently gives the child too much medicine and there is an adverse reaction?
Very often. And so this is not the first time that this has been looked at. And this particular study was just one of the more recent ones. And then to talk specific numbers, 83% of the parents that they were looking at in this group of 500 made some type of dosing error. And about a third of those were considered a large error, so potentially a double dose or more. And then as many as 12% were considered an overdose range of medication.
This is just parents who innocently, not realizing. Of 500 parents that they looked at in the study, about 10%, so actually 50 to 60 parents, were double dosing kids
yes, sir.
on medicine.
Absolutely. And so I think there's many different variables at play. And so one of which is a lot of this is very complex. There's a lot of math involved. And so most children's medications come in liquid form. Those liquids have to be dosed based on weight. And different liquids have different concentrations. And so if you haven't read the label or you haven't kind of had this very specific conversation with your doctor or pharmacist, it's very easy to make mistakes like that.
I see normally, when my son is a year and a half, when I buy him children's Tylenol, it comes with like a little plastic, like a scoop or a cup or something like that. It's actually a plastic. It looks like a syringe, actually. It's like a phony syringe. But what... To me, maybe I'm overdosing too. I certainly hope not. To me, it seems simple. It says 250, 500, 750, and I just put it into whatever level I'm supposed to put it into.
Absolutely. Well, so part of it is that tool that you mentioned, and so that little syringe is fantastic. And so not every medication comes with that. And so one, parents are sometimes intimidated by things like the syringe. Two, we're not very familiar with milliliters. We're using other forms of measurement, at least in this country.
Right.
Oftentimes people are used to those little caps or the capful with the lines on them, or if they may not be able to see the lines, or even dosing, instructions like teaspoon or spoonful. A lot of times that gets into a very subjective area. The syringe you mentioned is a fantastic tool that makes it much, much more simple for parents to figure out exact dosing. Can
we talk for a minute? Do you have information on the adverse effects, some of the things that can happen? I know with the children's Tylenol I use, I don't remember off the top of my head what the guideline is, but it basically says if you overuse this for your child, you can cause like serious kidney problems.
Absolutely. And so one of the more common ones is actually just stomach upset. And so you mentioned the over-the-counter medications like Tylenol. There are others. Most of the common prescription medications for children are antibiotics. And so even the normal recommended dose up to bigger doses and some of these incorrect doses, most of the time it's just going to be stomach upset, some vomiting, some diarrhea. Absolutely, you can get into things like kidney and liver problems at much higher doses, or even allergic reactions if this is something that your child hasn't been exposed to before.
All right. Dr. Myers-Hurt, where can we find more on the study, and where can we follow you?
I'm at diamondphysicians.com. This study and those like it are a quick Google search. This one was actually just based out of New York. It was on a website called MedPage. But any question you have, don't hesitate to talk to your family doctor, your pediatrician, your pharmacist, or even call Poison Control. Everybody's happy to help, and you can utilize these resources as a parent. All
right, Dr. Myers-Hurt, thank you for your time this morning. It's always something to keep in mind, and it's something I certainly read labels on end when it comes to giving my son some medication. Recapping again, a randomized trial involving 500 parents found 83.5% made dosing errors when giving their kids medicine, and about 12% were actually giving their child enough medicine, innocently and unknowingly, giving their child too much medicine to the point where it could cause an overdose. And obviously, that's got to be a worst nightmare for a parent, and you'd never want to be the reason that your child got sick or had some type of a reaction like that. So make sure you read the labels and make sure that you're providing any kids with the proper dosage.